David Cameron.
A strong NHS needs a strong economy.
Nick Clegg.
It's just simply not true that there's been some great push towards privatisation. This Labour government had wasted £250 million, you can't deny this, Ed Miliband, on sweetheart deals with private sector contractors in the NHS, which didn't help a single NHS patient.
Ed Miliband.
The Labour government transformed an NHS from 18-month waiting to 18-week waiting. That's our record. And now it's going backwards. You've broken your bond of trust on the National Health Service. They believed you.
I presented with a problem with my gallbladder. I had been waiting for many months and I had quite considerable pain, and I had requested a referral to Emerson's Green because of BRI.
When Jill Turner needed a routine procedure, she was offered an appointment at a hospital privately run by a contractor called KUK at Emerson's Green. But rather than being treated, she was turned away, told that the possibility of not being a day case made her too high risk.
The real issue for me is that having undertaken a CT scan and an MRI, they then made the decision they couldn't do it. Whereas the BRI, who do day cases, they are prepared and have the experience and skills to have dealt with something had it come up. In essence, the work that they did was a waste of money. It feels to me that they're just cherry picking. The impact on the patient is I then have to go back on a waiting list at the BRI. There's a huge waste of resources. I don't think it should be commissioned privately. I think it should be held within the NHS, where they can coordinate things, where the records are coordinated, and where you don't get this duplication of work.
When the NHS was born, private hospitals were excluded from treating NHS patients, but these days more and more work is outsourced privately. The debate around Emerson's Green has grown out of a £7 million underspend between 2012 and 2015 by the private contractor KUK. Since 2009, the company's had a multi-million-pound contract with NHS England to treat patients at the independent sector treatment centres at Emerson's Green, Cirencester, Shepton Mallet and Devizes. Sean Murphy, member of the Bristol group Protect Our NHS, explains how the £7 million figure came to light.
Our group has regularly attended clinical commissioning group governing body meetings, and most of the papers for those meetings are made public, so we've been reading the papers. What was going on at Emerson's Green gradually became clear to us, and we've made what has been happening public. Essentially nobody knew about the situation.
Protect Our NHS handed in an open letter to Bristol's NHS commissioning body earlier this year, signed by 64 GPs in the West Country. They claim KUK has received millions of pounds for operations it's not carried out, leaving the NHS to treat more complicated cases. Rachel Greck was among GPs in Bristol to sign.
Hi, it's Dr. Greck at the surgery here. The things that GPs would criticise is the fact that money's clearly been wasted and that they then have to spend time identifying patients who would be suitable at a hospital without critical care facilities.
Cherry picking, it's misinformed. The national contract for independent providers is quite restrictive, and so if there was anything to go wrong with any procedure where a patient needed intensive or high dependency support, then obviously they're not eligible in the first place to go to those facilities in the interest of patient safety.
Thomas Manning is Head of Information and Performance at South Gloucestershire Clinical Commissioning Group. He represents these groups, known as CCGs, which are mainly responsible for purchasing appropriate healthcare for local patients. Thomas explains local health policy must follow the guidelines of the annual block contract.
The contract between KUK and the Secretary of State is a guaranteed fixed financial value contract. If we do not match capacity, we are still obliged to pay. And that £7 million will be directly related.
But the private hospitals generally are not part of the training scheme, so they're not training up the junior doctors, the junior nurses. They're not producing our surgeons for the future. And by taking and cherry picking the easy, the safe, the less risky patients, it means that those patients are not left in our NHS hospitals.
KUK did not want to be interviewed, but refuse any allegation that they cherry pick patients. The types of cases they take on, they say, are under set guidelines by the local NHS. While the Department of Health argues private sector providers only carry out around 6% of all NHS work, the NHS Support Federation figures show as of 2013, 1/3 of all contracts awarded by local commissioning groups went to private firms like KUK. Some would say it's quite a big leap from what the NHS used to be about. But there's been a backlash in the community from Protect Our NHS's Sean Murphy, who's concerned that healthcare has to become a financial transaction.
How much money they're going to make out of it. What has happened here in Bristol is that over a period of 3 years, not enough patients have gone to Emerson's Green to meet the full operational capacity of the centre. As a result, Care UK has received £7 million for doing nothing at all. So that's been a gift from taxpayers.
And feelings are running high with the issue that goes right to the heart of the debate on the future of the NHS in England, with anti-privatisation marches taking shape in Bristol. Unite's Health Branch Secretary, Gwyneth Powell-Davis, is arguing the contracting out of care amounts to a form of privatisation.
It's important that people get involved in how our NHS is run.
It is part of the boosting of the private sector that they get this block grant, they get money whether they do the work or not, which is not the case for the NHS. An attempt by successive governments to actually boost industry, but via our NHS money, which I don't think is what most people feel they're paying taxes for the NHS for. But what you're actually finding is, in a time of economic recession, a new market is being found, the health market.
But the quality of care provided at Emerson's Green is more important than who provides the care, is Conservative MP Chris Skidmore's message to constituents, speaking at the local Kingswood hustings ahead of the general election.
If you're paying people profit, you could use that money to the benefit of those who need looking after, couldn't you?
No, because what we've seen with the Emerson's Green Treatment Centre, a number of constituents of mine said, "You're not going to close the treatment centre, are you? I've had fantastic service there. I had my knee operation there. I had my hip operation there." What it's done is actually relieve pressure off the NHS. There may be problems with some contracts, but you shouldn't ignore the fact that there can also be problems in the NHS. What we have now established is transparency. It's not a case of NHS good, other providers bad. Quality of care is not good enough. It doesn't matter who's providing it. That is unacceptable and it must be challenged.
Councillor Toby Savage, chairman of the Public Health and Scrutiny Committee for South Gloucestershire Council, says local health policy at Emerson's Green is good value for money.
As long as patients are being given quick access to quality treatment, free at the point of need, I do agree with Chris that if people's taxes are delivering those health outcomes that patients would expect, then I don't mind who is paid to provide that treatment.
But Karen Smith, Labour MP for Bristol South and previously a manager for Bristol CCG, says people would like to be consulted about their money going to private health firms.
It's a lesson for providers because the patients trust the NHS brand and they trust their local clinicians. People do care about profit making in public services. It is taxpayers' money, and Care UK do seek to make a profit, so I'm not sure that Chris is right about that. But there should be no reason why the NHS should not have been able to provide that service.
And according to Bristol CCG's figures, this year's annual patient and public involvement survey for Emerson's Green confirmed 92% of respondents rated all aspects of their treatment as either good or very good. John Briggs is a satisfied patient.
I'd had a cataract operation in 2014. The eye hospital is 18 weeks plus. I thought, well, that's rather a long time. But Emerson Green, it's 2 weeks. And I went, and they were absolutely superb. They did a laser operation on both eyes, job done, everything okay since. It was rapid. I went in quite early, I think it was Saturday morning, and was looked after extremely well.
The Emerson's Green Treatment Centre has been part of a contract worth £205 million and has been the beacon in Bristol for the debate over commissioning of healthcare outside of the NHS. With Care UK's contract ending in October this year, the management of Emerson's Green goes up for grabs. Back to Thomas Manning, who's leading the recommissioning. He says changes to the new contract will mean any qualified healthcare provider will only be paid for the work they have done.
We will be paying at tariff in the same way as we would if the patients were being treated at any other independent provider or NHS provider. Essentially, the transition from the ISTC contract moves Care UK into the same playing fields as those other providers. There's no guarantee of activity levels, there's no guarantee of finance levels, it's purely competitive-based patient choice.
With no guaranteed salary up front, bidding private companies may now be taking more of a risk, with profit margins more uncertain, and so the Emerson's Green debate continues.
The whole episode of going to Emerson's Green was a complete waste of time. You have to continue to then manage whatever condition you have, which isn't always pleasant. I don't know what the choices would be. It's very confusing for a patient.
All of this, to some extent, is happening under the radar. By definition, it's local rather than national. Some believe it's a Trojan horse for privatising chunks of the NHS. Others say it's a sensible use of taxpayers' money at a time of unprecedented pressures, which can only help patients. But it's an ongoing and increasingly noisy debate of the future of the NHS.